This is an information podcast on Alar Batten surgery. Alar battens are pieces of cartilage taken from the nasal septum, which is the wall between the two halves of the nose, or from the ear. They are placed in the side wall of the nose under the skin. The reasons for having Alar Batten surgery include nasal valve collapse, which is one possible cause for having a blocked nose. Alar Batten grafts are especially useful for addressing nasal valve collapse caused by a weak nasal side wall. The causes of nasal valve collapse include aging, having a blocked nose for a long period of time, previous surgery on the nose, injury to the nose, and previous radiotherapy. Nasal valve collapse can be treated by wearing external nasal strips during exercise or at the time of sleeping. A more permanent solution involves an operation called Alar Batten surgery. During Alar Batten surgery, the ENT surgeon takes a cartilage graft from the septum of the nose and shapes it into two strips that are then buried under the skin of the side wall of the nose. The cartilage helps stiffen the side wall of the nose, just as a collar stiffener makes the collars of the shirt more stiff. Before the operation, you will need to attend a pre-operative assessment clinic, which assesses your fitness for surgery. Here, we do some swabs checking for infection and request any necessary tests, which may include X-rays, ECGs, and blood tests. You will also meet with your ENT surgeon to discuss the operation in detail, including the risks and the benefits, and then he will take your consent for the surgery. The surgery is performed under general anesthetic. You will therefore be asked to stop eating and drinking from midnight of the day of your operation. On the day of your operation, you will come to the ward or wait in the day room, and the nurse will do some basic identity checks. You will then be seen by the anaesthetist and your consultant before your surgery. After your operation, you can usually go home on the same day, but sometimes people may need to stay overnight on the ward. We usually use a pack in the nose which dissolves after a few days. Using a salt water spray called Sterimar can make the pack dissolve quicker. You may be given other medication to take. Make sure you follow the instruction given to you about the medication because it will help reduce your symptoms. Your surgeon may arrange to see you in clinic 6 to 12 weeks after your operation. Patients are usually advised to take 2 weeks of rest following their operation. You should also avoid contact sports for at least 6 weeks to avoid knocking your nose whilst the bones are still healing. This surgery is associated with some common and rare but serious complications. Common complications include bleeding, but it is usually controlled during surgery or with packs. You may also notice a subtle change in the shape of the nose caused by the fullness of the side wall of the nose caused by the cartilage graft. Rare complications include development of a perforation, which is a hole in the nasal septum. This is rare, but if it causes problems like whistling, bleeding, and/or crusting, then further surgery can close the hole. Infection is uncommon but can occur and is treated with antibiotics. This type of surgery has an approximately 80% success rate in improving nasal blockage caused by nasal valve collapse. This is the end of the podcast. Thank you for listening. If you have further questions, please ask your ENT surgeon or nurse, who will be happy to answer them. Alternatively, you can visit the ENT Plymouth website at www.ent-plymouth.com.